Let's make sure I'm doing this right. It's me solo today. But welcome to the Dr. James Nurse Alice show. We do this every Monday, 5 p.m. Pacific Standard Time. And as you may notice, it's just me today, Nurse Alice, Family Nurse Practitioner and Clinical Nurse Specialist. Dr. James, my esteemed colleague, couldn't join us today because he is in the hospital. He is saving lives, y'all. He said the ER is swamped and he's admitting left and right, left and right, left and right. So he's not able to join us today. But still, the show must go on. And so many of you have been such great supporters watching us already every Monday at 5 p.m. So shout out to everyone who is watching from X, Facebook, LinkedIn, YouTube, and Instagram. Again, welcome to the Dr. James and Nurse Alice show. Dr. James, again, is away saving lives. I, on the other hand, was able to escape the ER for a little bit and join y'all today. So yes, check on in. Thank you so much. So again, everyone's going to be joining Instagram, Facebook, X, LinkedIn. What did I leave out? YouTube. So let me just go ahead and jump on into things. So although Dr. James isn't here, I wanted to talk about something that was really important that I see all the time, y'all, in the emergency room. And listen, I have to be honest, I can say that many people have had their experience, their preference. They have a palate for libations, and that's alcohol. I wanted to talk about alcohol because there's this new study out there that was recently published in the Alcohol Clinical and Experimental Research magazine that says alcohol-induced blackouts may be linked to how a person drinks, not how much they drink, right? So that's interesting. So let's just talk about it for a quick second. When people drink alcohol, they get intoxicated or they black out, we assume, you know what happens when we assume that the reason why they blacked out is because they drank so much. Well, we should reconsider. Sometimes it's not how much you drink, but how you drink. Okay, and so there's a new study that talks about that. And I think this is a very important topic for a variety of reasons, right? We know that certain drinking behaviors beyond just the quantity consumed can predict the likelihood that a person will experience an alcohol-induced blackout, right? That's a condition where you are still conscious, but you're unaware of your surroundings. It's the worst and unsafest condition, state of mind, level of consciousness to be in, because I've had several people come to the emergency room. It looked like maybe they were awake, but listen, lights on, no one's home. Weren't able to follow instructions, weren't able to control their bodily functions, vomiting, urinating on themselves, just in a blacked out state. And the worst thing about it is, we're taking care of them. We're doing everything we can. We connect them to the monitor. We're giving them IV fluids. We're giving them anti-nausea medications. We are trying, perhaps they need a Foley catheter. Sometimes we can't. They just pee on themselves, unfortunately. And we're trying our best just to monitor them, because we know people can go into seizures, especially if we're unaware of how much they drink and when they come out of it. But when they wake up, they have no idea. Let me tell you, repeat, they have no idea what happened to them. So when we think about alcohol intake, listen, I enjoy my adult beverage every once in a while. I drink responsibly. There are some drinks that, I'm like, oh, I like a little something fruity to the tootie, and just kind of relax, take the edge off of things. But everything must be in moderation. Everything must be in moderation. And I realize that there are multiple factors that influence how quickly alcohol is absorbed. But again, we need to look at that, because it's not necessarily how much you drink, but how you drink, right? So, but again, we got to talk about this because it's unhealthy, it's unsafe. It can put people in a situation where they can become victims of violence, sexual assault, taken advantage of. And that's really unfortunate. So for a variety of reasons, this was an important topic to talk about. So let me get back to this study. And in the study, the researchers, they looked at they found three different things. They found that the speed in which college students become intoxicated, so how quickly they become intoxicated, how long their intoxication levels are increasing, and the peak intoxication levels were each associated with experiencing these alcohol-induced blackouts. Now, I want to go ahead and say that this study was performed in college-age students, and what they did is they looked at over 80 sophomore level college and sophomores and juniors who typically drank 4 or more drinks on a weekend day, and they had experienced at least one alcohol-induced blackout during the past semester. Now, I don't know about y'all, but four drinks is a lot for me. But to each his own. But I am inserting myself in this conversation just to point out some of the potential harms that can come with that, and to just make sure people are aware of these things so they can make healthier and safer choices for themselves. But they looked at college students, and these students, they wore these kind of wrist-like devices, which were transdermal alcohol concentration sensors. I don't know that those are on the market yet, but I wish they were. I wish they were, because I have a feeling that more people would buy them. And who knows, maybe Apple or somebody's working on this, because on our wearable watch here, I can see my EKG, I can see my pulse ox, I can see my heart rate, all these type of things. So maybe eventually, right? But anyways, they wore these wearable devices that could measure their intoxication levels. So what they did is they wore it for 12 weekends in a row. And they also, had the students complete these diaries to assess their memories of the day prior. Lord, if they can only remember, right? And then, so over those 12 weekends, let's back it up. 80 people. We're talking about 80 people over 12 weekends. So what is that, like 3 months? So they basically watched the drinking behavior of 80 college students over a 3-month period, like looked over the weekend. So out of that, they detected a total of 486 days of alcohol use, and students together reported 147 alcohol-induced blackouts. That's a lot. That's really a lot. For you to be away at a semester doing all that, especially if I'm paying for your education, but I'm not going to go there. But anyways, they looked at that, and then 70% of the students experienced at least one alcohol-induced blackout, with 80% of them being females and 70% of them being male students reporting these blackouts. And the students who reported at least one blackout on average had 2.2. So they weren't blacking out once, they were probably blacking out more, at least 2.2. That was the average. So that's a lot. I think that's a lot. And I think especially, listen, I know you're in college, it's stressful. Everybody wants to relax. You're away from home, possibly making new friends, but we got to do this responsibly. We got to do this responsibly because, again, there's a lot of health hazards and risks that come along with that. And the interesting thing about this study is that the people who were involved, who participated in this, they weren't necessarily regular drinkers. They didn't drink every day or anything like that. It wasn't necessarily part of their regular regimen, but so it was how they drank when they did drink, which raises an important question about, do people understand what are safe alcohol? How many drinks can you have safely in a day where for the average person you would be okay and not become intoxicated? So I'm curious to know. I'm gonna go ahead. I haven't been looking at the comments or checking anything, but if anyone has any comments here, how many drinks do you think is, dare I say, acceptable before it starts to influence your blood alcohol level and gets to a point where it can influence your thought processes, your judgment, your mobility, all of those things? Anybody have any questions? Anybody want to take a stab at that? No? Come on, people. We got so many people watching. Again, I got people watching on Instagram, YouTube, LinkedIn, Facebook, and X. Anyone want to take a shot? Okay, no one. I didn't mean that literally, but that was so funny of me. I'm a comedian. I didn't even know it. So anyways, when it comes to alcohol drinking, basically an adult woman can have about 2 drinks in a day, or a man can have 3 drinks. And it has to do with our body consumption and how we process and digest that, which for the most part, when you drink that amount, for the most part, should be okay. But again, we know that there are other factors that influence that, like if you've eaten, how quickly the alcohol is absorbed, and things like that. But I think it's really important. So it's not necessarily that someone who experiences these um, blackouts, it's not that how much they drink, it's how they drink. And I think that's really what's important. So when we get into binge drinking, so some people may not know actually what binge drinking is, and that is actually the most common and costly pattern of excessive alcohol intake in the United States. So binge drinking is defined as consuming 5 or more drinks on an occasion for men and 4 or more drinks on occasion for women. So for those of y'all who are listening, who are watching, I don't know how many drinks you guys have had at a particular gathering, right? And it's also probably is dependent on the type of alcohol that you are drinking. So when we talk about what is a standard drink drink size, a serving, if you will, of alcohol is either 12 ounces of beer, 8 ounces of a malt liquor, 5 ounces of wine, or 1.5 ounces of an 80 proof distilled spirit like gin, rum, vodka, whiskey, one of those type of things. Now, heaven forbid, when you start mixing those things, you can see how that standard drink size can be out the window. But it was really important. And one of the things that I really thought about with this study is I don't think people are really aware all the time of how their drinking pattern influences how quickly they can become intoxicated or blackouts. And again, it's not necessarily the number of drinks you have, it's the pattern in which you drink it. So if you are someone who is drinking perhaps on an empty stomach, or you're someone who is drinking like maybe they're playing one of those drinking games, like spin the bottle, spin whatever, you answer the question wrong, whatever, you got to take a shot. Those type of drinks were many, those were examples of activities that actually increased the likelihood that someone did have a blackout. So, looking at this, it was really important to identify. We got to raise awareness to this, because this risky behavior, it is risky behavior. And in these settings in which these folks had these blackouts, the risky behavior was actually minimized. It became kind of the culture that, oh, we all do that. That's fine. That's not risky. That's just how it is. It kind of made a new norm. And actually, that new norm is something that is very dangerous. Again, can put you in very compromising, unsafe situation. It's very harmful to the body, the heart, the kidney, the liver, and so many other things. And heaven forbid, you then get behind a wheel. That's the last thing that we would like to happen. But it was really important to be able to identify that the speed in which these college students became intoxicated, how long their levels were increased, and their peak intoxication. So let me break that down. So how quickly they drank their drinks back to back to back to back, right? That played a factor. How long their intoxication levels were. So maybe they started drinking, but maybe they didn't get super intoxicated, but they were drinking all day enough where their levels were elevated. And so they were intoxicated for a longer period of time. And then also their peak intoxication with, when they did drink, how high did that intoxication level get? Really, really high. So those 3 things were identified, and having just any one of those increased their likelihood of having a blackout, alcohol-induced blackout. So, a lot of education needs to be done to educate people about the things that you can do to decrease or minimize the chances of intoxication. And I'll say this, and I would be foolish to ignore this elephant in the room. Some people do drink to get drunk. Whether that is trying to numb a problem or a situation that you're going through that you feel is unbearable. I don't know. I don't know that alcohol tastes that good, that you could just binge drink that much because it tastes so yummy. Could be. You might have found a drink that just tastes wonderful to you, or one of those drinks that doesn't taste like it doesn't taste like alcohol's in it. That could be one of the reasons why one would drink so much. But it's really important to identify these things, because alcohol-induced blackouts are a very significant problem, not just in college students, but in our nation, period, and then with significant consequences. So, prior studies reported that 80% of college student drinkers reported one, at least one, on an average of 8 alcohol-induced blackouts during college. That's crazy. That is crazy. And more than 3 additional consequences, which range from embarrassment, assault, and those type of things. So those are sequela, unwanted sequela of this type of drinking pattern. Again, when you have an alcohol-induced blackout, um, physiologically, it's not good for your brain, heart, kidney, lungs, none of that. It can interfere with your memory, concentration, ability to focus, balance, reactiveness, decision making, a whole bunch of things. And then again, it also puts you in very unsafe situations. So, anyways, as an ER nurse practitioner, seeing people often brought to the emergency room for alcohol intoxication is something that obviously I take the best care of them while I'm there, while they're in my care. But how can we fix this? How can we support the person so they don't have these type of drinking issues, or they're aware of it? Because some people may not know, even if, whether you're a quote unquote lightweight drinker or someone who drinks fairly often and feels like you can handle your alcohol. Again, if you change any of those 3 things that I mentioned earlier, you have an increased potential for alcohol-induced blackout. So I was doing a lot of talking, and I wasn't looking at the comments. Did anybody leave any comments? Let's see. Nope, not yet. And that's fine. That's fine. I think it's, I don't know. Maybe it's a topic that some people feel like, oh, Nurse Alice, I know that. I got that. Yeah, you may have that, but does the person next to you have that? So I think it's a topic that is worth talking about, because unfortunately, we see lots of injuries, insults, trauma, accidents, DUIs every year from people who are drinking. Injury and insult can happen to someone when they are experience a blackout, alcohol-induced blackout, and it's something that we just want to prevent. So, and I also thought it was worth mentioning just some interesting statistics here, and I'll go ahead and share them. When it came to binge drinking, remember I described that when we talked about what is quote unquote acceptable amount, considered a safe amount of alcohol for men and women to drink. Women 2 drinks a day, men 3 drinks a day. And again, there's some other variables, so don't just lock in on those numbers, right? If your stomach's empty, depending on the quantity and the type of alcohol you're drinking, that makes a difference. And binge drinking, more than 4 drinks for a woman, and more than 5 drinks for a man on any given event. And so when we get to binge drinking, how common is it? How common is binge drinking? Well, 1 in 6 adults binge drinks, with 25% doing so at least weekly. Binge drinking is just one pattern of excessive drinking, but it accounts for nearly all excessive drinking, with over 90% of the US who report drinking excessively doing binge drinking. That's not healthy for you guys. It's just not. Now listen, celebrate your graduation, celebrate your wedding, celebrate your win, your birthday, all of those things. I'm not saying to not enjoy an occasional adult beverage, but what I'm saying is do so and do so responsibly. You need to do things like, for example, make sure you've eaten something before you start drinking alcohol. Alternate alcohol drink with non-alcoholic drink, or drink a glass of water between glasses. That's something that's also important. I also recommend that people steer clear of drinks with mixed drinks with energy drinks in them, because the alcohol is more of a depressant, and then when you mix it with that Red Bull or Monster or energy drink, that is a stimulant. So you actually may be more intoxicated than you realize when you're drinking those mixed drinks. And then also you have to think about your body composition. People who tend to have more weight on them, tend to be able to tolerate more alcohol versus someone who's very slender and thin. So just a few things that you need to consider and think about. And then I'll also say, this is not a commercial, and this was just a plug that just came, that happens to come, that's coming in very organically and authentically. I was on the plane coming back from New Orleans, and you know, in New Orleans, it's catfish and nice drinks, and then also broiled oysters. I must say, delicious. But I got the chance to sit on the plane with the owners of a drink called Mockley Mocktails. This is just a coaster that they have. Now, let me tell you something. If you are somebody who likes fruity or mixed drinks, listen, that can sneak up on you as well. It can definitely sneak up on you as well. But these Mockley drinks give you the taste, the satisfaction of having a mixed cocktail drink without any alcohol. Without any alcohol. So hands down, if I'm ever, next time I have a party, I definitely will be providing Mockley mocktails as an alternative, because there's just something about it. Like, you pop that can open, and it was like a fruity type of drink. And they're different flavors. They're different flavors. So if you're not someone who's too fruity, don't worry. There's something for you. But it gave the kind of the feeling that I was having in an alcoholic beverage, but there's no alcohol in it. So that was something that I thought was really interesting. I wanted to share that. And let's see, what else? Do we have any questions on here? Because otherwise, I don't need to be on here too long. My right-hand man is not here, Dr. James Simmons. He's, again, at the hospital, saving lives, working as a hospitalist, admitting people into the ER. Fortunately, I was able to sneak out of the ER and be with you this evening. And again, the show must go on. So we wanted to still deliver some content, still say hello to all the folks on YouTube, Facebook, Instagram, X, and LinkedIn, because y'all have been faithful followers and watchers of our show every Monday at 5 p.m. And let's see. Sometimes people have questions, sometimes they don't, and that's okay. Maybe I did such a good job, y'all don't have any questions for me. That's how I'm gonna take it. That's definitely how I'm going to take it. But, all jokes aside, alcohol and binge drinking is a very serious public health matter. As a healthcare provider, as a woman, as a mom, I feel very compelled to talk about the importance or significance of this. Sometimes a good time can get away from us and put us in a situation where we didn't expect to be in. So we always got to keep it on the forefront, being mindful of what we're drinking, how much we're drinking. Do I have food in my stomach? Am I alternating alcohol drink with non-alcoholic drink? Am I watching my friends? Watch my friends. So, not just me, but hold on, maybe my girlfriend over here had a little bit too much drink. You know what? I'm gonna tell her to slow down a little bit, or just raise it. We should be able to have those conversations with one another. And it's all with love. It's all with love to make sure that everyone's safe. All right, let's see. A lot of people kind of joined in, they kind of tapped in and tapped out. Oh, James did join the conversation, but he wasn't able, I guess he didn't say much in here. That's it. Oh, here is the chat button. Baby, why did I not see the chat button? I'm thinking y'all not even talking to me. Y'all talking to me right here. Oh my goodness. Okay. I follow you from Ivory Coast in Africa. Thank you so much. Zachary, it is more, how do I do this? See, James usually does all this stuff. Okay, there we go. Boom, boom. I'm here with the comments. Okay, got it now. Okay, it's more common with people newer to drinking, or will veteran drinkers be risk as well? I think, that's a great question, Zachary. And I think that, listen, veteran drinking, I guess that's a thing, right? Someone who I'm used to drinking. So they may perhaps develop a tolerance to alcohol. However, I wouldn't necessarily count on that all the time, because every dog does have his days. Not calling the patient a dog, but I'm just saying sometimes it's just the body composition, what we're drinking, how much we're drinking, and even players mess up too. That's all I'm going to say. But newbies also probably very naive to the strength of alcohol, how it impacts them. And I will also say this: please don't try to experiment and go ham at an event or a party and you ain't got no friends there. You there by yourself. Please don't do it. Please do not do it. You need to go with a wingman, wingwoman, somebody. Somebody needs to know you're there and somebody needs to know you're drinking, because if something happens, they know that you were there, you were drinking, and so they can at least try to account for you or figure out where you are. Let's see what else. Okay. Hey, Dr. Farah. Sorry. Listen, I was so tech silly. I didn't even have the comments on. I thought y'all just didn't want to talk to me. Okay. Why does alcohol make you get me sick? Because you don't like the taste, because of the chemicals that are in there, because of the alcohol taste. Could be. Alcohol is not for everyone. And I have to say, some alcohols are really an acquired taste. They really are. And again, some people, they drink to get drunk. They drink because they know of the state of being and the relaxation that it's going to then create for them. They're not necessarily drinking for the taste. Because I'm going to tell you, some of this stuff is bitter and yucky. But who am I? I like a good fruity drink. But Goldie Red, if you don't like it, it makes you sick, don't drink it. And don't feel pressured. Don't feel pressured to drink it, because again, in this study, they talked about how the culture was normalized. These high risk behaviors were normalized. So people would be like, oh my gosh. Like if I came in like, oh my gosh, they're drinking what? What are we doing? Oh my gosh. It's almost like peer pressure. Okay, right? Like, oh, don't worry, Alice. We all do that. Everybody does that. Come on. Everybody has 20 drinks. Girl. Like, don't fall for the okie doke. Just don't do it. Dr. Frank, keep educating. Thank you. Let's see. Getting to the root of the problem. Why are they drinking like this? Exactly. And I'll say this. What people do in the privacy of their own home is their business. Absolutely. When you come into my ER, baby, it becomes my business. I'm just saying, how am I supposed to take care of you if I don't really know what you're doing every day? So I'm going to ask you, like, okay, maybe you're intoxicated. Oftentimes, let's just be honest, I can't even get any fruitful information from someone when they're at such an intoxicated level. I'm looking at friends. I'm looking at old medical records if we have them. It's trying to look at objective data to really take the best care of this person that's in the bed over here, throwing up, peeing on themselves, tossing and turning, and can't get comfortable. But why are they drinking like that? I think that's important, especially, and where I was going with that is where we talk about, when we get into alcohol, when we start to think that this is a problem, there's an alcohol use disorder. Are you drinking daily? Are you drinking alone? What is your mood like? Are you depressed? Looking at mental health status like that. And, what's your environment? Are you around other people who drink a lot? So there's a lot more that you need to tease out to try to figure out, why are they drinking? Are they drinking to feel accepted into, maybe someone moved into a fraternity or a frat place, and they feel like, oh, everyone's drinking. I got to drink if I want to be cool, if I want to, be accepted into this particular group. So those are things that we got to look at. Let's see. For all of you athletes out there, drinking messes up you. Yes, it does. Alcohol will give you a belly. Now listen, Dr. James is not on here to keep me appropriate, because listen, I'm a mama. I'm a healthcare provider, but I'm also a mama. So I'm going to tell you like a TI is. And sometimes that's just how it's got to be. In the emergency room, it's just me and you, baby. We got to talk about what's going on. What is going on? Why are you drinking like this? And we just have to talk about it. And I will just honestly say that alcohol, there's a lot of empty calories in there. So a lot of empty calories, it can give you especially over chronic use, can give you that beer belly, that I'm pregnant look, or I got a ascites look. Don't be mad at me. Be mad at the alcohol, because that's what it does. I didn't make up the science, and you drank it, not me. But those are some of the things that can happen to you. Let's see what else. But it does mess up your gains, especially if you're an athlete, you're exercising, trying to be lean, muscle build. It's definitely gonna mess up your gains. Okay. Now I think I got all the comments. And these are comments that are coming from YouTube, Twitter, LinkedIn, all over the place. Let's see. Did I miss anything else? No, I don't know that I missed anything else. I mean, this is a topic that I could talk about forever, but I'm not going to, because it's my duty as a healthcare provider is to raise awareness to particular topics, mention what your resources are, which, by the way, if you would like more information about alcohol use disorder, binge drinking, and those type of things, you can visit asknursealice.com. I have a free health library that is evidence-based, research and evidence-based, updated by medical writers on a daily basis, powered by HealthWise. That is basically a tool equivalent to what you would get on a hospital website. So bye-bye, Dr. Google. Hello, asknursealice.com, health library. asknursealice.com/health library. It's free, evidence-based. There's articles, there's scales, there's tips, tools, videos, you name it, it's there on every topic, from alcohol use disorder, binge drinking. You want to know more about how alcohol affects the mind, all that, it's all there. It's all there. Just go ahead and go. Just go ahead and go. Okay. And again, Dr. James is usually here with me. And I know he's not here right now, but he's here in spirit. He is here in spirit, and he is admitting those patients. So still do me a favor and make sure to follow him at Ask the MP on all social media platforms. He does this amazing thing on TikTok every morning called Morning Rounds. Lots of wonderful information there, especially if you're up early. He's like 7 a.m. Pacific time. Tons of great information there. So follow him on all things social, Ask the NP. He also does have a website. Check that out. And then also, well, you're watching me, so you must follow me, but sharing is caring. Make sure to share this with a friend. Share this episode with a friend. Tell a friend they need to follow Nurse Alice and Ask Nurse Alice, and they need to check out the health library, asknursealice.com/health library. And oh, by the way, I do got a podcast called Ask Nurse Alice. Check that out on your favorite podcast platform. Tons of wonderful, great information there. And that's it, people. That's all I got for you, unless there's any more questions. Any more questions? Let me see. Make sure I do this right. No, that's it. So, okay. Well, I'm out of here. I got to go. I'm tired. I was literally taking care of patients all day. Wanted to still make it here with you all. Again, Dr. James is here in spirit. I'm Nurse Alice. Thank you so much for watching the Dr. James and Nurse Alice show every Monday, 5 p.m. Pacific Standard Time on all platforms: YouTube, Facebook, LinkedIn. Ooh, who did I forget? Hold on. I forgot somebody. YouTube, Facebook, LinkedIn, Instagram, and X, and TikTok. Dr. James is a TikTok. I don't do too much ticking or talking, but y'all got me here. So thanks so much for your time and energy. Thanks for tuning in. Thank you for sharing. And until next time, guys, please, please, please make good choices, be kind to one another, and live well, my friends.